Lovely stuff. All right. So first of all, I'm going to hand over to James Neffendorf.
Thanks very much, Rob. Can you advance the slides?
Yeah.
There we go. Brilliant. And then to the next one, and then we're good to go. Okay, so welcome everybody. My name's James Neffendorf. I'm a consultant ophthalmologist at King's College Hospital in London. I'm also a senior lecturer at the university there, KCL, and I'm also the deputy medical director of a private clinic called the London Lauriston Clinic. And I'm a consultant ophthalmologist and retinal surgeon specializing in all diseases of the retina, both medical and surgical, as well as cataract surgery. And I think we really appreciate the time you've all decided to take off tonight, or in some cases this morning, for the Down Under followers. And it's, really close to Christmas, of course. And we find these webinars are a great opportunity for us to discuss the latest updates and exciting developments in retina and glaucoma. Tonight, we're talking about artificial intelligence. I imagine some of you may know more than others about this subject. It really is something that is exploding in healthcare and eye care. Last week, I was at a conference in Italy, and there was a huge session solely based on artificial intelligence, which is a major change because a couple of years ago, you'd have been lucky to even hear one presentation on it. So this is something that is moving very fast, and I hope to give you a bit of information about AI in general, then some applications in how AI in retinal disease is being used, and then I'm going to hand over to my colleague, Dan Calladine, who's going to talk about glaucoma, and then, as Rob said, we'll hopefully have some time for some questions. Just in terms of my disclosures, I'm a consultant for Radiant Science, which is a group looking at AI in the information gathering. I'm also an honorary medical director at an AI group called SolveMed, and this company is involved in using smartphones to interpret the way that people react to light and diagnose things like neurodegenerative disease, like dementia. And then also, we're going to hear more about OcuPlan later, where I'm head of retina. So what is AI? If you put this into a search engine, ironically, the top information you now get on the search engine comes from AI on Google. And I've taken various descriptions from different websites about what they describe or define AI as. So some people say a technology that allows you to generate, classify, and perform tasks. Another website says the simulation of human intelligence processes by machines, especially computer systems. Machines can learn from their experience and adjust to new inputs. And then finally, another website says the ability of a machine to display human-like capabilities such as reasoning, learning, planning, and creativity. And I think taken together, these all give a really good overview about what AI is. Next slide, Rob. And of course, everyone is rightly skeptical when it comes to new technologies. And in medicine, we have very rigorous processes before any sort of new treatment or diagnostic modality is allowed. But what about AI? Well, things probably aren't quite as stringent yet, but a lot of background work is being done. So as an individual listening to this, you might worry about it, or in some cases be happy about it. But actually, many daily life activities that you may be familiar with are already using AI all of the time. Virus checkers that you might have on your computers, like McAfee, or if you do internet banking, there's a huge amount of AI that's done in the back end of these systems, such as in banks, to identify and prevent fraud. And some of you may be familiar with some of those social media website icons like Facebook or YouTube or Twitter, and those websites leverage a lot of AI to help the information that we get. And as I mentioned, Google as well is now using a lot of AI to help prevent misinformation and provide us with accurate information. So AI is all around us, and actually sometimes we don't realize it. And actually it's the sign of an efficient technology when it seamlessly integrates into our normal life without being noticed.
You've got them? Yes.
Next slide, Rob.
So sweet.
And this year in particular has seen a huge explosion in AI, and the Royal Swedish Academy of Sciences awarded a number of prizes to AI experts. So John Hopfield and Geoffrey Hinton were awarded the Nobel Prize for Physics for their work on artificial neural networks, which I'll mention in a moment. I had the pleasure of meeting Professor Hinton at a talk quite recently, and he's a tremendously impressive scientist. And then on the next slide, you can see these next three clinicians, so David Baker, John Jumper, and Demis Hassabis. Rob, next slide there. They were awarded the Nobel Prize for Chemistry. So there's a lot been happening, and these awards are given for the highest level of scientific ability, and it shows you that AI is here to stay, and it's going to have a major effect on all of us going forward. So there are different types of AI, and I don't want to turn this into a really complex scientific lecture. You could talk about this for days, but broadly speaking, you've got simple automated detectors, and that's where you give algorithms to a system to identify the presence or absence of features, and then it combines the answers that it gets to give you an overall answer, or in the case of medicine, potentially a diagnosis. And that's the simple end of it. The more complex end of it is machine learning, and that's where you provide a machine with a training data set to learn from, with layers of what we call neurons in what's termed an artificial neural network. And then the machine then learns to determine the outcome and diagnosis. And the big difference here is that it doesn't need to follow explicit instructions in order to make its predictions. So it's actually learning and doing things itself. So what challenges are out there? Clearly, this is a huge step forward in so many ways, but as with any step forward, there are various aspects that we have to think about. So the first aspect, Rob, next slide, is the quality of the outcome of the AI that we use is dependent on the quality of the input. And this little diagram shows you that if you put very poor quality information into a system, the quality of the information you're going to get out of the AI system is going to be poor. And this is where we get the rubbish in, rubbish out phrase from. And in healthcare, you can see why this would be really important. So it's a priority for us to make sure when we're building these systems that we make sure we really use information of the highest quality. And then here we have a black box. And this is an issue that we know as the black box theory. And that is that we don't actually know sometimes what the AI is doing or how it's come to the conclusion that it has come to. And this lack of transparency of the algorithms could be, of course, concerning, or in some cases, the artificial intelligence is identifying something that we didn't even know about. In ophthalmology, an example is that when AI systems have been used to look at pictures of the back of the eye to diagnose patients with, for example, diabetes or eye problems due to diabetes, when it's been learning how to look at these pictures, the systems have been able to identify from those pictures whether or not they're looking at a man or a woman's eye. Now, interestingly, if you ask any ophthalmologist to look at the same pictures, they won't be able to tell you if it's a man or a woman's eye. So there's something about these images that the AI has identified to show that it's a man or a woman, and we just don't know what it is, and we still don't know what it is. So you can see where this black box sort of concern comes from. And we have to make sure we can trust it for our healthcare decision making. Next slide. And this leads us into ethical issues. Here you see a robot sitting in a courtroom. And of course, we might not expect that to happen in the long term. But we do clearly need to be concerned that any AI-enabled technologies could potentially make an incorrect decision and result in harm. And legal liability is a very interesting subject. Many of the AI products available right now are purely supportive. And as patients, I think you should be reassured that anything we're using as clinicians is a system that we fully understand what the technology is trying to do. And also we keep a very close watch on what it is doing. But the overall legal liability for these systems is still to be decided, and this will develop with time. It's an accelerating subject. And of course, everyone says, well, will I ever see the doctor again? Am I just going to dial into a webinar like this tonight and that will be it? And they'll tell me what's wrong with me and some medicine will arrive in the post. Well, I don't think that's close to happening. And I think rather you should think of this as being a supportive way of working. And an analogy is that when you get on an aeroplane, you get on and you see the pilot standing there at the cockpit. And of course, we're all very happy to see the pilot, but the pilot also has autopilot functionality in the cockpit. And I think we all find that very reassuring. So it's the combination of the human elements with the machine or the AI sort of elements, which is how medicine is developing. Interestingly, there are some specialties different to ophthalmology, like radiology, when you go and have an X-ray or a CT scan. And of course, you go and you see the radiographer, they do your scan, you go home, and then you get the results. You never actually meet the radiologist. And we're seeing AI technology be able to do the reporting of these scans. So for those professions, actually, they're getting quite concerned about their job security. But I think for specialties such as ophthalmology, the same thing happening is a lot further from happening in terms of time. And I still think you're going to be seeing doctors for the foreseeable future. The final element, well, there's lots of things, but one of the things I wanted to mention tonight is who's paying for this. And many of these technologies are very cheap to design and develop and then implement, but others are very expensive. And it's going to be a challenge for us as healthcare providers to work out what's good value for our patients and, what does improve outcomes and efficiency. And that's something which we will, see develop as time goes by. So this is the sort of schematic which describes how things are going to go. You can still see the patient arriving on the left-hand side in their yellow jumper. All their information's being taken. In that case, you can see a heart tracing. The doctor in the white jacket is doing a bit of work on the computer. And then you've got that central square platform where it's combining all of the information. It might be the examination results, some of the history, the genetic material, the scans, the medications that you're on, and optimizing those, because we all know that a lot of people take a lot of medicines. Maybe sometimes they're not all necessarily required. But that final step, you can see in the back right corner, it's still the doctor talking to the patient and conveying all this information. And I think that sort of halfway house is where we're heading. So what about AI in ophthalmology? I think this is a very large subject, but broadly thinking, we can split this into a three-pronged approach. So firstly, making things more productive. Secondly, improving our decision-making. And thirdly, improving how we communicate with you, our patients. And I'm going to briefly touch on each of these now. So I mentioned before about diabetic eye screening. So in the UK, if you have diabetes, every year you're invited to have a photograph taken of the back of your eye. And those photographs of each eye looked at usually by opticians or sometimes some doctors. And they analyze whether or not there's any problem. And if there's not much of a problem, they say, we'll see you next year and do another photo. But if there is a problem, you get sent into the hospital so we can have a look. And if we have to do treatment, then we do. But you can see how that's a very time-consuming process and a lot of resource involved. So AI programs are now looking at that sort of image, which you can see on the screen, which is a photograph of the back of the eye, and giving us a rapid answer as to what the diagnosis is. And clearly that would make everything far faster, more productive, and get you as the patient to the right place in a faster way, and ultimately get your treatment faster. And you can see why this sort of thing would be of huge benefit in the developing world or in countries where they don't have as much resource to deliver this sort of system. So that's one example of how AI can help with productivity in ophthalmology. And if we now move on to the next section, which is clinical decision making, and Dan is going to talk about glaucoma shortly, but what you see on the screen there are 10 annual photo or 11 annual photos of the back of the eye, actually looking at the optic nerve, which is like the end of the cable which joins the eye to the brain. And this patient has glaucoma, but over the 10 years, you can see that there is a little bit of change, but it's exceptionally subtle. And even the change in the vision, which are the charts at the bottom, the change is quite subtle. And it can be quite easily on a year-to-year basis to miss any subtle change. And AI programs have the ability to really interrogate this data in a careful way and then tell us as clinicians, actually, there is some very subtle change happening here. And ultimately, that could be the differentiator in us saying, well, we're going to change your medication and hopefully stabilize your disease. So it has the potential to transform our ability to monitor disease, not only diagnose it. And then for patient communication and information, I think everybody can empathize with the fact when you turn up at hospital as doctors, we ask you a huge number of questions. And then you go and see another doctor and you get asked all the same questions again. And then the same thing happens and you get bored by answering the same questions over and over again. So what we're working on are different systems where actually you can just give this information once to an automated, almost like a robot. And then that robot combines all the information and can disseminate it to the relevant doctors. So they have it all. And then they can actually spend the time talking to you about the things you want to talk to them about, rather than all of your medication lists or you know, subjects which you know are not as important to you. And if we can do that with AI, we can do things like remote consultations, reducing the amount of time you have to spend in the hospital, reducing the follow-up visits, and improving the link between primary and secondary care. So maybe just seeing your optician rather than having to come in and see the ophthalmologist, when we could look at your scans, maybe use some AI features and say, look, actually everything's safe, we don't need to see you now. Or saying, look, we've identified a problem, we're going to get you in. The other area that's quite interesting is predicting outcomes. So ocular plastic surgery describes eye surgery on the eyelids. And what we're able to do now with some computer programs is show you a picture of your face and say, with this surgery, this is how your face might look afterwards. So if you have problems, for example, with eyelid position and things like that, you can actually see a photo of how you might look in the future if you were to undergo that surgery. And that's a massive step forward in the way we consent and the way we provide information. And finally, from an information sort of for you point of view, we're also using systems such as, you might have heard of ChatGPT, which is one of the large language models that's been developed. And this is where you can type a question in, such as, what is age-related macular degeneration? And it will give you AI-generated information on that condition. And as healthcare professionals, we're now performing research studies to see how accurate that information is. And what we're finding is actually that it does have a role, and we can, you know, we can direct you to these sources so that you can be really well informed of your conditions and also the treatments that are potentially out there. Next slide, Robert. So finally, I'll just do a few slides on AI and the retina. There are 4 conditions in those different pictures. You've got dry macular degeneration in the top left. You've got diabetic retinopathy in the top right. You've got wet macular degeneration in the bottom left. And then in the bottom right, you've got a condition that affects babies called retinopathy of prematurity, which is when babies are born very prematurely, and it's a potentially blinding disease. And artificial intelligence is being used in all of these conditions now. And actually, AI, next slide, Rob, is being used for both the diagnosis for some of these and even more than the ones I just mentioned. So things like retinal detachment, sickle cell disease, inherited retinal diseases such as retinitis pigmentosa, you might have heard of. These are diseases that run in families, and other things such as macular holes. And what we're able to do is not only help us make the diagnosis, but also help us monitor these diseases over time. Next slide, please. And the imaging that we do, you've probably seen some of these scans before. These are pictures of the back of the eye, a black and white picture there looking at how the retina fluoresces under different light conditions, a plain photograph in the top right, and then a cross-sectional scan at the bottom called an OCT scan. And we do a lot of these OCT scans in the clinic. And if you've seen these in the clinic, you've probably seen how we look at them, and that's by going through all the cross sections. Next slide, please. And I'm not going to go through this long list, and I don't expect you to read it all, but there's many different things that we're looking for. These are all the markers and the signs that you can potentially identify on one of those scans that I just showed you. And I'm going to show you a slide in a moment which puts that into practice. So all of these different things potentially show disease, and the artificial intelligence programs are now looking at these scans and rapidly telling us if any of these features are present. Next slide, Rob. And I'm grateful to Ultras AI, which is an advanced AI program that we've worked with for the next few slides. Now, that cross-sectional OCT scan there is one section of the retina. And when we do these scans, we often take 128 of these lines, and you'll have seen us scanning through them and scrolling through them when we're looking for disease. Now, what this system is able to do, it's able to rapidly look at all of those scans. And in the box on the top left, you can see how it's got different colors. So if it says that scan is normal, it presents it as a green color. If it thinks it might be abnormal or it has a moderate severity of a problem, it presents it as a yellow color. And if it thinks there's something severe, it presents it as a red color. So straight away as a doctor, I can look at that scan and say, well, look, I need to focus on these areas rather than wasting time looking at areas that are most likely normal. And on the next slide, you can see that we can take things one step further by looking at the abnormal areas, and then it tells us exactly what the different areas of abnormality are. So in this case, this patient has wet age-related macular degeneration, and the artificial intelligence has told us that there's fluid in different layers of the retina, there's some bleeding, there's some disruption to the normal architecture of the retina, and that it's quite grossly abnormal. And this is a patient then that would be identified as needing urgent medical intervention. And then the next slide shows another example of this. In this case, it's actually a patient with dry macular degeneration. And again, the color coding identifies different signs that the program has managed to pick up. So what you can see here is that we're really getting to a point when we can look at scans, we can track scans over time, we can see if you're getting better or worse. Often with something like dry macular degeneration, you may be diagnosed at the optician, you wouldn't necessarily see an ophthalmologist. And then when you have repeat scans, we can look at these scans and say everything is stable. The artificial intelligence has showed us there's not a problem. Or conversely, we could say there is a problem. Now we're going to get you in and get you seen and potentially have some treatment. So with our ever busier clinics, we're trying to improve the quality of care by integrating these AI systems into the work that we do. So finally, I think, you know, the benefits are that we're able to probably do things faster, with more accuracy. It's more repeatable, so it's not dependent on the doctor that you see on the day. We're removing that variability and being more consistent. And they say that together everyone achieves more. And I think the human plus the AI functionality is likely going to be better than either one of us alone. And that's the direction we're going. Next slide. So I'll leave you with this. AI can help solve healthcare challenges and improve outcomes. And I think it's here to stay. And I hope that it, you know, I've managed to explain to you that it's not a worrying thing. It's actually something which is there to help you and something which we're keeping a very close eye on as doctors to ensure that we're improving the quality of the healthcare that we can provide to you. So thanks very much for listening. If anybody has any questions, you're very welcome to email me on that address, or you can get in touch with my team on that telephone number, and I'll do my very best to get back to you, whether or not it's about, you know, an individual problem you have, or if it's more a general question about, you know, something that you found interesting. I'm now going to hand over to Dan Calladine, who's a colleague of mine. He's a ophthalmologist, ophthalmic surgeon, and a specialist in cataract surgery, corneal surgery, which is the front of the eye, and glaucoma. So over to you, Dan.
James, thank you very, very much. That was a fantastic summary and quite in-depth analysis of AI. I really appreciate that. I wish AI could cure my cold. Sorry if I'm sounding quite croaky. I hope my voice will hold out for the talk. So I was fortunate to be part of the founding team of OcuPlan, and I've really tried to develop it to help patients, with a cost-effective way to get the care that they need. So just to declare a financial interest there. But as James says, I'm also a consultant ophthalmologist working in the West Midlands. So next slide, please. Okay, so I'm sure you're all very familiar with visual field machines. Probably half of you hate them with a passion. They are difficult to do. They're testing your levels of your vision, what you can see, what you can't see. They often look like this Humphrey visual field here in the picture. And these machines, for many years, they've been able to look at progression analysis with glaucoma. So they've been able to look at your visual field test from one year to the next and produce very useful information on whether or not your glaucoma is getting worse or not. But the thing about AI is it's kind of elevating this to a much higher level, because what it's trying to do is effectively introduce what we call quantum data. So it's taking data from lots of different areas. So it might take data from your visual field tests. It'll also incorporate things like your eye pressures, your visual acuity, and the OCT scans, and it's able to process all that data in a way that actually it would take a human mind quite a long time to do that. And I'll explain this a little bit later. And then it's trying to start adding a subjective opinion. So, James gives some very good definitions of what AI is, but effectively it's doing things which it would take the human mind quite a long time to do and wouldn't necessarily be the most appropriate use of that time. Next slide, please, Rob. So just before I move on, I just want to talk, just to remind everyone about what glaucoma is. I know this is a joint talk for macular and glaucoma today, but I do recognize some of my patients from the names that have popped up here. So I do know a few of you have glaucoma. So first of all, it's a triad, and traditionally it's optic nerve damage of a specific type with a corresponding visual field loss, and usually the eye pressure is high. So you can see in the bottom right here, there's a picture of an optic nerve with a white arrow just pointing, showing an area of the optic nerve that's damaged, and that corresponds to a visual field loss. And when combined with a high pressure or a progression of that disease at a high pressure, that's the classic diagnosis of glaucoma. Next slide, please, Rob. So I asked AI, can it help diagnosing glaucoma? Just like I've showed that classic triad there. And yeah, I mean, it comes back as saying, yes, AI has the potential to assist in the diagnosis of glaucoma, but it can't replace a comprehensive eye exam by a qualified healthcare professional. And the three things that AI can do with glaucoma is analyzing retinal images, which I think is probably the most powerful and most useful thing that AI can do for glaucoma. Identifying visual field defects on visual field machines, although as I said to you before, most of the modern visual field machines are quite good at doing this anyway. And then predicting disease progression. So although the visual field machines can show signs of progression and the OCT machines can show signs of progression, what AI has is the potential to combine those two things to get a much more accurate diagnosis of the condition in the first place in early stages, and also to help look at progression analysis. Next slide, please. So the caveat was that AI said that, however, it's important to note that it's not yet perfect, and it should be used as a tool to assist in diagnosis, not as a replacement for a comprehensive eye exam. So not to replace, for instance, seeing me in clinic where I can have a look at your eye and look at all the various bits of data points and check the pressures. So therefore, a qualified healthcare professional will be able to interpret the results of the AI-assisted tests and make the diagnosis. It does comment that early diagnosis of treatment of glaucoma can help in prevent visual loss, which of course we know. Um, and if you are concerned about glaucoma, it's important to go and get a comprehensive eye test. So really, it's very difficult to then think, well, how can I access AI if it has to be under clinician review? Next slide, please, Rob. So it's quite difficult, I think, to think about the access to AI because it's a bit sporadic, it's a bit disjointed. There are some exceptions, okay? So there are some opticians which have programs like the Altruist AI that James just talked about. But very few clinicians actually use AI because effectively the AI is trying to do what we do as clinicians. And we've been doing what we've been doing for clinicians as a long time now. So it's very difficult to kind of like, it's hard to kind of adopt something which is kind of doing what you're doing anyway. It's really easy to get OCT scans and visual fields tests and pressure checks done at your opticians. It's very tricky to get AI analysis of these with clinician overview. And however, AI has the potential really to give a much better understanding of diagnosis stability and progression, which is something that I believe. But again, how does one actually pragmatically use AI for glaucoma at the moment? Okay, next slide, please, Rob. Okay, so this is what, having digested all the literature, to me, it seems that the most useful thing about AI at the moment is looking at a part of the retina called the ganglion cell layer. Now, this is the neurons which take the image signals from the retina to the optic nerve and then down the optic nerve to the brain. Now, this part of the retina is full of thousands of data points, and slight asymmetry between the top half of the retina and the bottom half of the retina can be an indicator of glaucoma. And it's actually quite difficult for the human eye to compete with AI on something like this. It's a bit like what James was saying earlier about the AI retina scans being able to identify if a retina was a male or female, and we don't know how it does it. Well, there are so many data points in this ganglion cell layer, and early changes in that layer can help with the diagnosis of glaucoma and also to know if it's stable or not. And this is an area that I'm working on at the moment to try and incorporate more into our practice. And I really think it's probably the most useful, pragmatic use of AI for glaucoma at the moment. Okay, next slide, please, Rob. So this ganglion cell layer is all throughout the retina, and here are some pictures just showing how high pressure in the eye can push onto the retina. And there are some pictures here of the ganglion cell layer on the right, and this will give rise to specific patterns of damage, which are a precursor, really, of where the full-blown glaucoma is going to happen. Now, when these images first came out, and the OCT scans were able to identify this layer, it was almost thought that it was kind of like a bit of a retrograde thing, where you get damage at the optic nerve, and then you'd later see changes in the retina. But it's becoming apparent that actually early changes in this cell layer can then show us where the glaucoma damage is actually started before it becomes apparent at the optic nerve. And I think that's a really powerful use of AI in analyzing this part of the retina. Next slide, please, Rob. So James is probably not quite as old as me, but when I first started in ophthalmology, OCT scans were so rudimentary. I mean, I remember seeing some of the first prototype OCT scans, and they were almost like a game of Pac-Man, and really gross chunks of color with very difficult to tell the different layers. So on the right here, we've got a quite an early OCT scan from probably about 20 years ago. But, they were even more simple than that before. And they were extremely useful for diagnosing conditions, but they weren't particularly powerful or useful for looking at signs of progression and things. And if you look at a modern day OCT, which is this black and white picture here, and look at the cross section of the retina, there's so much detail on there on the retinal layers, and particularly that ganglion cell layer, that it's quite hard for the human mind to be able to analyze that in a way that gives it its full benefits. So I think this is really where AI is particularly helpful. So it can look at subtle trends and changes in this ganglion cell layer, and it can compare them in kind of a quantum approach by combining it with other packets of data from like the visual field tests and the visual acuities and the pressures to really help give the clinician a powerful tool to help him work out whether or not something's stable or not. Next slide, please, Rob. So, AI is a solution. So we need to combine AI with clinical oversight. This will vary depending on which clinician you see as to whether they embrace AI. And what we've tried to do at OcuPlan is we're integrating the Altris AI into our remote services. So when people have OCT scans, we're able to look at that ganglion cell layer and can really start to help us as clinicians identify patients who've got early glaucoma, or also whether or not things have been stable. It's very hard as a clinician. You look back at people's scans from the previous year, and sometimes changes are so slow that you actually kind of do miss things. And we try our best, of course, to not do that. But it's just inevitable due to human error just to process that amount of data. And I think what AI will do with the glaucoma service that we're developing is mean that in terms of the ganglion cell layer, we really aren't missing anything there. So it should give us OCT analysis with the ganglion cell layer scrutiny. We'll be able to contextualize it in terms of visual field and pressure, and we're able to offer advice about diagnosis. Okay, next slide, please. So just in summary, AI is really promising with ganglion cell.
Okay, I think Dan has paused there. Fortunately, it was on Dan's final slide, which is his summary. So I was just going to quickly run through the key points that he just spoke about for the last few minutes. And he was about to hand over to me, actually. So first of all, I'd like to say that was a really, really interesting talk by James and Dan, really informative. I hope everybody on the call found that as intriguing as I did, because I think it's probably something to be quite excited about, really, with this, with the progression in this technology, and it's only going to get better, I think. OcuPlan as a business, we try to keep abreast of the. Oh, Dan, are you back? No, it doesn't look like it. Looks like Dan's dropped off there. But we try to keep abreast of the new technology that is happening within eye care. So I'm sure that over the coming months, as this technology progresses, we will be putting on more sessions like this. I wanted to very quickly talk a little bit about the new OcuPlan remote consultant service that we have just launched recently, where we do utilize AI within this service. The new remote service is as it sounds. It's consultant-led care for people that are living with conditions like glaucoma and AMD, without having to visit the hospital like you normally would. This is the first of its kind within the industry. We're not aware of any other services like this, where opticians and consultants combine their services to provide a comprehensive report like this with the use of AI. So we're really excited about it, and we're really proud of it, actually. We're getting some great feedback up to now in terms of the early users. The reason that we've developed this service is based on feedback that we've received from patients and from professionals. So we've spoken to hundreds of people with conditions like glaucoma and AMD, and we've spoken to lots and lots of opticians and consultants about a service like this, and everyone agreed that there should be a new option really for people that are living with glaucoma and AMD outside of the NHS and outside of private care or traditional private care. That is accessible and cost effective, and that's what we've looked to create, and it's a service that is, I suppose, especially created for those that struggle to get the care that they might need. So for people that, for example, James mentioned people that are living with dry AMD, there isn't a pathway for people that are living with dry AMD at the minute. They are told by their optician that they've got this condition that they can see at the back of their eye. It's a long-term eye condition that might be sight-threatening, and that's quite stressful and worrying for a lot of people. But unfortunately, there isn't a pathway for them to go and see a consultant because there isn't an opportunity to. There's too many people with this condition and not enough consultant ophthalmologists. So I suppose the best feedback that we've had up to now is from people living with dry AMD who says that this can actually help them to be more informed on their condition, that they can get a consultant to review their eyes. And similarly, people that are living with stable glaucoma as well, we're getting some good feedback where it's a little bit mixed in terms of the level of service that people get at the minute. Some people say that where they are, it's great. They get as much time with a consultant as they need. And others say that they don't get any whatsoever. So having an opportunity to have a consultant review their condition as accessibly as this has been received really well. With regards to how it works, so you still have your optician visit, you still go and see your local optician. Those scans are then sent automatically to OcuPlan. That is where we integrate AI into our systems as well. It then goes through to the consultant to review, so they have all of the AI assisted advice as well with them at that point. They review the scans and they provide a report, a comprehensive report within about 10 days. Of you seeing your optician. So it's quick, it's accessible, and it has that advantage of utilizing that AI technology as well. Bear with me, next slide. So the report itself, this is what you're provided after 10 days. Okay, so it's a comprehensive report completed by the consultant ophthalmologist with a bit of a recap on the scans and the tests that you've had done. You get an in-depth overview of the findings that you've had from the consultant ophthalmologist, and then the recommendations on what they think the next steps are. So do we need to offer any sort of treatment? Is it a case of you looking after yourself at home, and advice on maybe things that you can be doing to help yourself? And then some helpful links to guides and charities that might be able to help you as well. Now we have just launched. It's been received really well. We have got a bit of an introductory offer on at the minute. I'm not going to go all salesy on everyone, I promise. But right now it's available at £75 if you're a member of Glaucoma UK and Macular Society. So yeah, it's been received really well. If you think that this might be something that could help you and it might provide you with a little bit more peace of mind, please feel free to contact us. You can go on our website there and find out a little bit more there, which is ocuplan.co.uk/remote-service. You can give us a quick call and we can take you through how it works and your local opticians. And we have the lovely Georgina in the office as well, that a few of you might already know, who can answer any questions as well. And her website is, her email address is just there. So I think that concludes. Dan, James, thank you again. What a brilliant talk that was. Really, really informative. I hope.
Thanks, Rob. Sorry, I just cut out there. I think my internet just went for a minute. Just so I was summarizing. Sorry about that, everybody. I've noticed a couple of questions that have come through. So just one of the questions here from Karen, talking about different parts of the country and, how we recruited consultants and opticians in that area. I think the nice thing about the remote service is it's less geographically bound for the consultants. So effectively the remote report will be reviewed by myself if it's glaucoma orientated, or by James if it's retina orientated. We find that optometrists in particular quite like doing this new remote service, because effectively they're doing the pressures as well. It's a bit more holistic. They'll be checking the visual acuities and uploading the various data. So in theory, we have some contracts now nationally with some of the optometrists, where we should be able to cover new areas like that. So I think the key is really to give Georgina a call at OcuPlan, and she'll kind of reach out to some local opticians who we think will be able to help you with that. And then in theory, if it's, as I said, if it's glaucoma, it'll be me reviewing it, or if it's retina, it'll be James.
Mm-hmm. Wonderful. So Dan, I don't think we have any other questions, but we probably do have a little bit of time. If you do have a question, there's a little feature at the bottom of your screen. It might be on the side, but it's got a little hand that is raised like that, which means that you're basically holding your hand up. I think that's probably the best way to manage it. We've got quite a few people in this call, and if we all start talking together, if you do have questions, it could be quite confusing. So if you have any questions, press that little button at the bottom, and we'll spend a few minutes answering a few questions.
I did see someone's hand go up during my talk, but I've forgotten who it was now.
Yeah, I made a note of it actually. Yeah, we did. It was someone.
No, don't embarrass them. They might not want to ask the question.
No, okay, all right. Well, yeah, if you've still got a question, like good suggestion there, Dan. I won't call that person out, but yeah, if you have still got a question, pop the hand up, and yeah, we'll answer that. Okay.
No, it's looking fine. Okay, well, yeah, thank you very much for organising this, Rob, and thank you very much for everyone attending. You know, we're trying our best to try and create solutions for patients with macular disease and glaucoma that they can access, that they can afford. Things are really difficult in the NHS at the moment, and things can get so expensive in the private sector. And you know, not only that, we've got patients who are refused care by their private medical insurance because it's pre-existing, or it's like considered to be monitoring. And so, you know, things are a bit of a pickle at the moment. So you know, we are trying our best to try and make this kind of as accessible and as affordable as possible, but it is a real challenge. And you know, any feedback that we get from you guys is really helpful. I know the support groups we've done with the Macular Society and the Glaucoma Society have really helped us to kind of shape these new services. Mm-hmm. We do seem to be now providing the services that the members are looking for. And yeah, I hope that you can benefit from those, and I look forward to helping you with that process.
Right.
Thanks. All right. Thank you, James. Thank you, Dan. Thank you, everyone, for attending. This has been recorded, so I will send it out. So if anybody wants to watch it back, they certainly can. You'll get an email tomorrow with the recording. But yeah, any questions whatsoever outside of the remote service, if you've got any more questions on AI, please feel free to contact us, and we'll try and be as helpful as we can. Lovely. Thank you, everyone. Have a nice rest of the evening, and yeah, we'll keep you in the loop on future events that we do. Thank you.